Evusheld is an intervention that provides passive immunity for patients who are immunocompromised against COVID-19. It's a combined medication with Tixagevimab and Cilgavimab. So it's used as an injection at the same time in order to provide passive immunity. And these patients really require some prevention because they are severely immunocompromised. Unfortunately, many of the COVID variants are starting to become resistant to this intervention. So, things are always changing, but definitely there's a need for providing some passive immunity to our patient population. We really looked at 3 endpoints in this study. We looked at whether the patients had any COVID-19 after they had their Evusheld dosing. We also looked at if they did have COVID-19, whether they were requiring hospitalization or supplemental oxygen. In those outcomes, we saw that only 2 of our 18 patients had COVID after their injection of the Evusheld, so it was quite effective there. And only 1 of our patients required hospitalization, and none of our patients required any oxygen. So really great outcomes as far as efficacy goes. We also looked at the endpoint of GvHD. So we looked at whether patients had GvHD before, whether they had it after, and then if they did have it, whether it got better or worse. And we did have a couple of patients that had new onset GvHD and 2 that had a flare of their current GvHD. But because they're such small numbers, we really couldn't quite associate it because we also had 2 patients who got better and then several who didn't have any. So it's hard to gauge because we didn't have a control group in that patient population. But we also looked at hematologic parameters. So we looked at like white blood cells, hemoglobin, platelets, and absolute neutrophil counts. And we saw really no significant changes in those. Really, everything remained quite stable. So we overall felt like it was safe, it was effective. We didn't have any adverse events, and the hematologic parameters didn't change. We did have some GvHD, but whether that's really associated would have to be really further studied.